pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So, on behalf of the commissioners, I want to thank those who are attending. Thank you for coming here today. There is a budget message that we'll read into the record and then follow that up with any questions from the press that they can talk to myself, Tom, Mary Jo, the commissioners, whatever you guys want to ask, you can shoot, okay? Let me just say before we do that, let's talk about the budget hearings that are coming up. So October 25th at 10 a.m., we'll have the first meeting here in the conference room. On the 26th at 2 p.m., we'll be in Troop Borough Building at 436 Sanderson Street in Troop. On October 28th at 2 p.m., we'll be at the South Abington Township Building of 104 Shady Lane Road in Chinchilla. And October 29th at 1 p.m. in the Thornhurst Township Building at 356 Old River Road in Thornhurst. Space is limited at each location, and masks are mandatory. Okay, Lackawanna County's 2022 budget message. 2021 Lackawanna County budget funded accomplishments. The year 2021 can be characterized as a truly different era in Lackawanna County government. Traditional economic development activities, community reinvest funding, law enforcement initiatives, programs to assist families and older adults, and some community events were all coordinated, but with safety as the underlying current. The main focus was the health and welfare of all county residents. The ultimate concern was to combat the very stubborn COVID-19 virus. The Commissioners committed $1 million in CARES Act funding to the Area Agency on Aging Department to protect the county's 210,000 residents against the virus. A comprehensive plan was developed and executed with a variety of concerned partners to accomplish this task. Testing and vaccination of older adults in 13 high-rises and communal living facilities began in late December 2020 and has never stopped. Medical delivery was also provided to the homebound, ensuring their safety. A major ad campaign was developed to spread factual data on the perils of the virus and the importance of getting vaccinated. The commissioners have and continue to encourage all residents to get vaccinated for their safety as well as the safety of family, friends, and other residents of Lackawanna County. Lackawanna County partnered with Family Services Association of NEPA to expand the 211 services in order to provide vital testing data and, more importantly, assistance for securing an appointment to get vaccinated. Strong alliances were forged with area pharmacies, healthcare providers, social services agencies, nurses, nursing students, and other groups to provide food, tests, vaccines, transportation, and a host of other amenities for people to survive and stay healthy. Lackawanna County joined the Kick COVID-19 Consortium to deliver even more services and information. Over 45 public clinics at community venues were held to provide convenient vaccinations for our residents. The March 2021 clinic with Hometown Health at the Montage Amphitheater drew over 3,600 people, along with the accolades from Governor Tom Wolf. Record keeping on the vaccination distribution was vital to ensure that Lackawanna County received a continuous supply of vaccines. We joined forces with the Greater Scranton Chamber of Commerce, area colleges, and other affiliates to develop a program for inputting data, thereby removing the burden for small pharmacies so that they could focus on vaccinating our residents. Additional clinics with various incentives are still being held, focusing on ethnic and faith communities and high school youth. Civic functions like Give Back on the Mountain were also scheduled. The virus did not overlook any segment. Residences and businesses suffered great economic loss, resulting in the loss of jobs, cutbacks, and reduced hours. To that end, the Departments of Aging, Human Services, and Economic Development offered programs for rent, utilities, and mortgage relief with CARES Act resources. A variety of business incentives grants were also developed and implemented. The county received tremendous news in March when the Commonwealth approved the Department of Health designation for Lackawanna County. That has opened the door to numerous resources and services to keep people well and active. In mid-July, the county hired an epidemiologist and then adopted ordinance number 272 in August, establishing the Department of Health and Human Services. This allowed the creation of a community board and the hiring of a director in the future to run the operation. All All the aforementioned actions led to the current 76% of fully vaccinated rate for all of our eligible residents. In addition to fighting COVID, the Departments of Human Services and Aging administer their traditional services, and human services continued to aid the homeless. The family unit is and always will be a vital concern. Opioid treatment for youth was funded by a grant to get teens back on the road to recovery and a normal life. Suicide is one of the leading causes of death in the United States. It affects people of all ages and socioeconomic backgrounds. It is also no stranger to our community. To that end, the Lackawanna County Suicide Prevention Alliance was formed to provide assistance to individuals and families who are dealing with this issue. The Area Agency on Aging is dedicated to the health of our older adults, as witnessed by the numerous wellness contracts that were approved for exercise, social activities, nutrition, and much more. This department has also entered into a new 5-year agreement with the state for over $5 million annually to develop cutting-edge initiatives which will make a difference in the lives of many individuals. While a great deal of focus in 2021 centered on mitigating the virus, the vision for new growth and opportunities did not cease. The commissioners acted swiftly to bolster the economy through a myriad of grant programs aimed at assisting businesses from all sectors. Over $2 million was invested in the local hospitality industry. This spring, the very popular Community Reinvest program awarded 21 grants, totaling $101,338 for projects throughout the county. CDBG funds were again provided to the municipalities for projects aimed at improving infrastructure. In addition, CDBG funds were used to fund the Mortgage and Utilities COVID-19 Assistance Program. Low-income, first-time homebuyers also received support with resources for closing costs. Because the music and entertainment industry was hit hard by the pandemic, the Department of Economic Development provided up to $25,000 in music grants to assist performers to get back on their feet. Fair and equitable property taxes have long been discussed. Far too long under the current system, many residents have been overburdened. For over 50 years, everything has remained static due to the outdated assessed property values. To that end, an RFP was sent out in midsummer seeking a firm to conduct a county-wide reassessment to establish a fair, equitable, and uniform tax structure. The safety of the community continues to be a major priority. Grants for bulletproof vests and civil disturbance unit were utilized to further enhance security in our area. Continuing education is essential in all fields, especially public safety. Training was offered by Penn State for our sheriffs and parole and probation officers. Our broadband and 911 databases were upgraded to provide more information for those who use the network, which translates into faster response time to assist those in need. The prison is another important element in county law enforcement. It has undergone an administrative restructuring that has streamlined duties to be more effective in the areas of security, treatment, and operations. Changes were necessary to ensure the enforcement of the county's chain of command policies and protocols. Preparing a prisoner for his or her return to community life is vital, especially as it pertains to successful reentry into our community and the reduction of recidivism. To assist with that transition, a behavioral health department was created at the Lackawanna County Prison. This has enabled staff to provide one-on-one clinical counseling with inmates as well as group programming, which centers on self-help topics. In partnership with Lackawanna College's Police Academy, a community awareness program for law enforcement agencies was developed. The 4-part series focused on critical issues including racial profiling, de-escalation training, substance abuse issues, and mental health disorders and awareness. The COVID-19 virus brought a grinding halt to all community activities. Under the guidance of Governor Wolf and the CDC, the county's Arts and Cultural Department awarded a series of grants to help organizations and agencies with the difficulties of the reopening process. Over $145,000 in program grants were awarded, along with spring and summer COVID-19 grants in excess of $236,000. The traditional $500 municipal grants were also given out on a periodic basis. Our parks opened up for residents to picnic, recreational activities, and family gatherings. Additionally, the Scranton Ballet conducted a novel beach event at Covington Park. The county's transportation network remains a vital element in the community's economic landscape. Paving projects and bridge repairs and replacements were funded by the commissioners. The commissioners recognized the importance of providing public transportation so that our residents can conveniently get to work, school, and medical appointments. In early spring, the Commissioners extended the certificate of incorporation for Colts for 50 more years, ensuring that the bus fleet will continue to provide uninterrupted services for our residents. Our debt position. The county has been able to mitigate its annual expenditures for debt service by taking advantage of favorable interest rates. The interest from the refinancings of 2018, 2019, 2020, and 2021 allowed the county, without extending the maturity of any of the refinance bonds, to maintain its annual debt service in a manageable range. The county will continue to be diligent when seeking further opportunities to restructure its long-term debt. Financial policies of Lackawanna County for 2022. In 2022, the Commissioners will again be conservative and demonstrate fiscal responsibility, restraint, and management when addressing the county's financial challenges. The administration will continue their commitment to addressing the constant challenges facing county government on numerous fronts, especially in the area of its workforce. Personnel-related expenses such as salaries, wages, and health care comprise 65.77% of the county's general fund budget, net of tax transfers out. Important features of the budget for 2022. The 2022 general fund budget includes no property tax. Many man-hours went into the preparation of the county's 2022 fiscal blueprint. Its goal is to service the 210,000 residents. The budget reflects no cuts in programs that our communities and our residents rely on. The budget also contains provisions for our parks, human services programs, aging initiatives, environment, and spraying for gypsy moths and black flies, while also monitoring for various other pests. We continue to meet the challenges of an ever-changing society by doing more with less in a fiscally responsible manner. It is vital to secure public input on this financial plan. The budget hearings are the perfect venue for the public to provide the Commissioners with ideas which they can review and implement where possible, to help cut expenses further and generate additional revenue. The cost to run county government and its various programs is substantial. A prime example is the prison. A great deal of revenue is expended for staff programs, medical treatment supplies, and other ancillary services. The prison restructuring and changes related to the security treatment and operations were implemented for this very reason and will continue to operate as efficiently as possible. Reasons for the major financial policy, expenditure, and revenue changes from the 2021 budget. Due to continued pressure from shrinking federal and state funding, collectively bargained wage and benefit increases, and the rising law enforcement costs, the county's 2022 budget will exceed the 2021 budget. During 2021, the county was able to capitalize on a significant surplus in its debt service fund. Since the debt service fund surplus was depleted, the county will need to transfer additional funds from the general fund to the debt service fund for 2022. As previously noted, the human services area continues to be the main priority of the programs offered by county government. In addition to that sector, emergency response, the court system, and other vital functions will comprise the majority of the county's 2022 expenditures. Our budget revenues for 2022, the general fund budgets total $148,406,629. The 2022 debt service budget total is $19,491,214. The 2022 special purposes fund budgets total $81,029,657. This budget message is respectfully submitted on the 15th day of October 2021 pursuant to Section 1.12-1203 of the Lackawanna County Home Rule Charter. So submitted. Madam Chairwoman, at this point, you can open up the meeting for any questions from the press or anyone else that has an attendance here.
I'm opening the meeting for any questions from the press. Anybody have any questions?
I do, yeah.
Do you want to go behind the podium and speak at the mic?
You need me to?
They do, yes. Usually. Can you hear them okay or what? You have to go behind the podium. That's what it's there for.
Yeah, could, I understand this has like roughly an 8.8 operating deficit in this budget. How do you intend to make that up if you're not going to raise taxes? Do you intend to pull money from the surplus, cut expenses? Could you sort of explain what your process will be to balance that and when you have to do that by?
Does Tom, I mean, we're still actively working on the budget. Usually I don't need one.
Press the button.
It's on. Oh, no, there it isn't. I mean, we're still actively working on the budget to try to reduce that deficit. But maybe Tom Durkin, our CFO, would be in a better position to answer. Or Jeff, or Brian Jeffers.
We're obviously going to look at where we can start trimming the budget, and we will sit here for the next month and try to get that deficit depleted.
Yeah, like I don't want to give examples of things we're looking at, obviously, but we are, it's an ongoing process is what I'm trying to say.
I guess my question is, I mean, you're committed to not raising taxes. Is that the case?
I can only speak for myself, but yes.
Okay.
And I believe that my co-commissioners, yes, as well. Am I wrong? Keep going, go ahead.
This budget also will budget an extra $1 million in overtime for the prison. Can you sort of explain, the need for that at the prison?
I believe it was due to the change in the medical department, but one issue that you'll see change with regard to the prison is that we are, recently, I think last year, started a tablet process because we eliminated physical mail and things of that nature through our telephone provider. So we already receive funds, generate revenue through the phone system and through the tablets, but we're currently in renegotiations because we're on a month-to-month with them right now, and we hope to generate more revenue due to the increased use of tablets, the increased presence of tablets at the prison, so it's one-on-one. And again, there'll be certain sign-on incentives and hopefully an increase in the percentage of the revenue that the prison, albeit the county, receives as compared to prior years. So while there is $1 million that you're speaking of, which I do believe is due to the medical, there will be other areas of the prison which will be generating revenue, which I believe will help cover that. Do you understand what I'm trying to say?
Right, and I also noticed that the medical services is you're saving about $1.3 million in medical services.
And it got to the point where, over the long term, we're going to have less litigation. To my knowledge, and speaking with them just the other day, we've had no grievance and no medical grievances when we used to have from inmates, a foot high. So I think in the long run, the medical department is going to show its benefit in terms of reducing litigation, helping with recidivism, which means that we won't have people going in and out of the prison like a revolving door, so the taxpayers won't have to pay for those people to keep going back in. So I think that, it was a necessity, and I think in the long run, everybody will see the benefits play out.
Okay.
Did I answer that correctly?
Excuse me. Dave said, and this is true, the medical spend at the prison is down $1 million from last year.
Oh, I thought you said okay.
It's down $1 million because we had to budget additional monies last year when we were doing the 2021 budget because of the pending end of the contract with the previous provider and the unknown future of what the contract was going to be for the new provider. So we budgeted a significant amount more last year than we need to budget this year because we budgeted based on what the actual contract with the new provider is now. So that's what the difference in the $1 million is. We knew we had the transition coming. We didn't know what the new contract was going to be, and we knew that there probably would be some hang-around costs for the old provider too. So we were able to reduce that to what the actual expenditures are according to the contract.
I apologize. I don't know why I misheard increase instead of decrease. Maybe I'm just used to hearing that.
Have not been clear.
But in any event, the prison is a very large part of our budget. And the changes over there, I do believe, will ultimately generate more revenue. And I think good things to come.
Right. In your budget message, you mentioned reassessment. Is there money in the budget to conduct reassessment? I see that there's roughly a $200,000 increase in the assessor's office. I don't know if that's related to gear up, perhaps?
I mean, the department itself, we obviously we haven't made any specific decisions with regard to any increases in staffing. We're in the process of doing that in conjunction with the budget process for the assessors, but we're going to need a larger assessor's office to accommodate reassessment once the process begins. The RFP, I believe, came back. They had questions, the companies, they were answered, and then 2 companies responded to our RFP, which I think was due back by September 23rd. And where are we from there? Tom, do you want to go from there? Like, what he's asking?
We received the 2 proposals, and the committee is beginning to review those proposals. I'm not sure how long it's going to take to get through them, but when the committee completes the proposals, I don't know whether they're intending to interview the 2 companies or not, or whether that'll be part of the process or not, but whenever they get done, and it's gonna take a while, because it was an extensive RFP, so we've got 2 extensive proposals, so it's gonna take a while to review, but.
And remember when we discussed this a while ago, maybe a year ago or so, my understanding, I don't know if it's still like this, but my understanding, or my last understanding, is that even when we choose the company that we are going to utilize for reassessment, there's a certain level of delay before the process even begins. I think back when we talked about it, it was like 18 months before they could even start the process.
Proposals, Commissioner, if we engage somebody in early 2022, I think ambitiously, we could expect at best to implement the new assessed values probably in 2025. It's going to take that long. But to specifically answer your question, Dave, we did shore up the increase in the assessment office, at least in the tentative budget, was because we know that we have to shore up the office and get more personnel if we're going to do the reassessment. So that is what the increase is in the assessment office. Whether or not that stays, I don't know, because we may find that whatever the company that's going to do the reassessment may not even be able to begin in 22, so we may not need to hire those people in the commissioner's or in the assessor's office, as the commissioner stated. But at least in the tentative budget, we did shore up that office in anticipation of the work that they'll have to do for reassessment.
This is my last one. You also talked in your budget message about the community reassessment program. It looks like in the tentative budget, you have increased that money for that program substantially.
I think you're talking about community reinvest?
Community reinvest, yeah.
So right now, I think the budget has the 900,000 and
That is
400,000 in there, and we are looking at whether we're going to keep that number or reduce that number. We'll have to sit down with, obviously, the finance people and the director of economic development and the commissioners.
I believe it was at 900, and then it was reduced.
In
So-
last year's budget.
Right, in last year's budget.
900 reduced to 500. The budget request from the department was once again 900 this year, and that's what sits in this budget. So
Okay.
it shows a $400,000 increase theoretically from last year to this year, because we haven't reduced the $900,000 request this year, and we did reduce it by 400 last year.
And we are looking at it. It's just that that money is utilized to help county residents and businesses. But at the same time, again, with the deficit, we have to look at that, and, something has to give. So we'll be looking at it.
Very good. Thank you very much.
Anyone else? All right. Thanks, everyone, for coming.